Sexually transmitted diseases are usually treated as a few days of discomfort from which we then move on and assume that everything else is fine. But that's not true, because from the World Health Organization, numbers show that every single year there are millions of infections that are happening that go unnoticed because they do not have any signs or symptoms before they even happen. Also, that 1 in 3 infertility cases usually result from some infections that were left untreated or unattended to, or which had inadequate treatment, resulting in infertility that we see amongst women. And also 70% of women, as well as 50% of men, have infections, or should we call them STDs or STIs, that are very hard to notice because they go without any signs and symptoms, and this actually makes them more dangerous and very, very risky situations. So what are STIs or STDs as we always hear them, but what's the difference between them, and how can we understand them better? You are welcome to NTV Medical Matters. I am Viola here, and I wish you a very happy festive season. But this morning we shall be talking about STDs or STIs, a very, very convenient time because everybody's out there merrymaking, but this is the time when you could actually lose your life because of STDs. We are supported by Bill and Melinda Gates Foundation, and we are going to have this discussion with a doctor who is already here in studio, and I will have the privilege of introducing him and a very complicated, work that he does, which also reflects in his titles, but I'll try and do him justice. So he is Dr. Damlira Adrian, and he is a GYN fertility specialist and laparoscopic surgeon from, what was the hospital again, doctor?
Sichom Doctors Hospital.
Sichom Doctors Hospital. That is the Luganda word. Sichom, it's not for just one person, is it? Yes. That is the right translation. All right, so he's here, and he has brought us a full package of what STDs are, or STIs, and how best we can stay safe from them. You're welcome once again.
Thank you, Viola, for welcoming me. Dr. Damlia Adrian is my name, a gynecologist, laparoscopic surgeon, and a fertility specialist, working with Sichom Doctors Hospital. It's located at Bulaga, Michiana Road. I'm glad to be here.
We shall actually need more about the location because our viewers will need to come to you when the time is right. But without further ado, let's just talk about STIs. In simple terms, what are STIs? And for someone hearing this for the first time and who has ever been diagnosed with something of this nature but does not understand what are STIs, please answer that in the simplest of forms for us.
Okay, STIs, we term it as sexually transmitted infections or sexually transmitted diseases. These are infections or diseases that are transmitted on through sexual intercourse. And nearly 90% of all of us engage in sexual intercourse over time, and many shy away whenever we talk about sex. But as we close the year 2025, it is important we discuss sexually transmitted infections, because as people engage in sexual intercourse for pleasure, it comes along with other complications. And these are the complications we're going to discuss about today.
And talk about STIs, I'm actually really smiling because I was, my producer is wondering, what is it because of the topic today that you had to wear sunglasses? Can you actually get them off? We need our viewers to look at you and take your information seriously. Thank you for that. Okay. So for someone saying that I was treated, but I felt better, but after some time this kept reoccurring or affected my ability to have children, what could have gone wrong yet they received treatment?
Okay, thank you for that good question. Sexually transmitted infections, as you hear the term, it is passed on from one partner to another. So many times patients come to clinic, and majorly they are the women. Men rarely come for treatment. And this means that many times we are treating one partner and we are not treating the second partner. So it is paramount that we treat both if we want to prevent recurrences.
So why do STIs in some cases carry more shame than fear, yet the consequences are very dire? And you mentioned something interesting that a lot of women come through, but the men don't. So why do you think they carry so much shame instead of the fear of what might go wrong?
Because they are sexually transmitted, many don't want to associate themselves with sex. Yet we are all products of sex, and this comes with some of these challenges. So if you talk about sexually transmitted infections, there are different types, or there are different categories. But for our viewers to understand, we shall break them into I will use the word bacterial because most of us now understand or have heard about the word bacterial. There are also those that fall under viruses, what we call viral STIs. Majorly, I think we shall concentrate on that, and then we shall discuss the long-term consequences. And one of the major long-term consequences is infertility.
And before the consequences, when you talk about STDs and STIs, I will actually need you to talk about the types even further. But what is the difference between STIs and STDs?
The terminologies, they are just used interchangeably.
Okay.
An infection is the same as a disease.
Okay, so let's talk about the types. What are some of the types?
So the types, we have bacterial, and bacterial, I want to start with what we call Neisseria gonorrhoeae. Neisseria gonorrhoeae, those who understand Uganda, they call it enziku. Then there is chlamydia. So these are some of the commonest bacterial infections, and they normally present as, for a man, majority of them will have no signs and symptoms. The few will have a pus discharge at the opening of the penis, where urine passes. Some will have pain, and others will present in a later time with failure to make a woman pregnant, what we term infertility. If it is a woman, many present because they have failed to conceive. And those who get acute symptoms, acute, I mean, as soon as you get the infection, within a few days or weeks, you start experiencing signs and symptoms. Some will have pelvic pain or abdominal pain. Others want to call it stomach pain. Some will have abnormal vaginal discharges. Some will feel pain while having sexual intercourse. But as I said, majority come to us following a good period of time failing to get pregnant.
So what are the virus-oriented ones?
The virus-oriented ones, the commonest that you and me fear is HIV.
I thought Candida. Where does Candida fall? I've been waiting for that.
Oh, okay. Candida is not a virus, and it is majorly not termed as a sexually transmitted infection, but at times it is sexually associated. But HIV is one of the commonest that people fear most. But there is what we call hepatitis B and C. Most of us fear HIV, but hepatitis B is more infectious. You can easily get it more than HIV.
Where do the infections come from? The ones from the washrooms, where do they fall in this category?
Okay, the ones we get through contamination from the washrooms, we don't term them as sexually transmitted diseases. The ones that are sexually transmitted, we get them through sex. Sex can be vaginal, it can be oral, it can be anal.
So from your experience, what is the most misunderstood STD that is very dangerous and has a long-term effects, but for a common person it feels like, I'll be okay with that? What is that? I
would consider chlamydia, trachomatis. And
does it have another name that we can associate with what we've had before?
Another name in Uganda,
okay.
Maybe Nziku for gonorrhea, but the chlamydia, I'm not sure about the Uganda name.
Okay.
But this is a silent infection, and it affects the fallopian tubes. And over time, these fallopian tubes get blocked. And when they get blocked, a woman might fail to conceive, more especially if both the tubes are blocked. And when they are blocked, we shall advise for things like laparoscopy to help and unblock where possible, or if the damage is very severe, we shall recommend IVF. So to me, the one that is most disturbing, but people ignore, I would consider that to be the bacterial chlamydia and Neisseria gonorrhea.
When you speak about unblocking the tubes, does that mean that the woman is then able to conceive once you have gone through with that surgery?
Yes, depending on the location of the blockage. There are those types where when we unblock, chances of getting pregnant are higher. So, but most of these infections cause what we call distal blockage. Distal, it means the blockage is at the farthest end of the fallopian tube, and the success rate is minimal.
Is that all you do under laparoscopy? It's very hard for me, actually.
It is called laparoscopy.
Okay, so when you explain that to someone else having a hard time saying that word just like me, what is it about? Is it only about unblocking tubes, or is it a whole set of surgery for different things?
It is a whole set of surgery for different things, but one of the commonest surgeries we do is in relations to the tubes, or in regards to infertility. Women are failing to conceive, and we want to know whether the problem is coming from the fallopian tubes. Yes.
When you speak about STIs, looking at them generally, is there a difference between the STIs for women and the STIs for men, or is it just the same but, you know, manifesting or behaving differently in their bodies?
They are the same, but the manifestations can be different, and the consequences can be different, at times similar. For instance, if we talk about human papillomavirus, it is that virus that causes cancer of the cervix. And we acquire this through sexual intercourse. It can also cause cancers in men, but these cancers are not common.
Okay.
Compared to cervical cancer in women. Yes.
What are some of those cancers in men?
You can get cancer of the penis. You can get anal cancer, especially for those that engage in anal sex.
So when you look at STDs, can someone live with an STD, unaware of it and having no symptoms at all, only to realize later when they're trying to conceive that they've been sick all along?
Yes, this is very possible. And as I said, the commonest reason why women seek medical care in my practice is failure to get pregnant. And one of the leading causes of acquired infertility is a problem with the tubes. And a problem in the tubes many times is as a result of previous sexually transmitted infection, especially the chlamydia and gonorrhea.
What STDs usually affect someone silently without presenting any signs or symptoms, only to show out later that there had been damage in their body?
Okay. I would, one would be syphilis. Syphilis.
You did not mention that. I was actually wondering, where does it fall?
Syphilis, in Uganda we call it kabotongo.
I wonder what it's called in Runyankole.
You tell me what it is called.
I don't know.
Yes,
I wish I knew.
But though our brothers and sisters in traditional, I think they are misleading. Any woman with abnormal vaginal discharge, they are calling it kabotongo, which in reality it is not. Syphilis is caused by a bacteria. In science we call it Treponema pallidum. And many times the first contact you might not experience, might not realize that you have acquired it until a time later. For instance, for some of the women that get pregnant and they are coming in for antenatal, it is one of the routine tests we do. That is when we realize that, yes, so you are infected with syphilis. Some babies are born with what we call congenital syphilis. Some get syphilis and it affects the brain and the spinal cord. So these take years. It can even take 20 to 30 years before realizing that you acquired this.
I was actually going to ask you a question whether someone could actually have an STD for, experience an STD at 20 and then live a very happy and joyful life, only to find out later around, say, 50 that it's been in their body all along.
Yes, it is very possible, and this is how most of them behave. I have talked about hepatitis B. Hepatitis B, it can end into cancer of the liver, and this usually comes in at a very late stage. Usually 20 years, 30 years. I have talked about human papillomavirus, the one that causes cancer of the cervix. Speaking
of that one, what are some of the STDs that actually have vaccines for them before they get to that level?
Yes. Thank you for that question. And the commonest is human papillomavirus.
That one I've heard of.
Yes, the human papillomavirus. It causes cancer of the cervix, And these vaccines, they are available free of charge. We have them, and the target group, they are girls who have not yet engaged in sexual intercourse, between 9 to 14, majorly we say 10 years. Even boys can be, but according to our national Ugandan policy, we are looking more onto girls. So you can get this vaccine, and nowadays it is a single dose, and you can prevent this. So if you have a young sister around that age, please.
I wish I had.
Okay.
Let's look at infertility, and this is one of the, I think, the most common experience that a lot of couples go through and may not understand why it's happening. So infertility, when you have an STD, or say you're not aware that you have, but you're infertile or you aren't able, we call them barren, which is a very traumatizing, statement. But when STDs happen in your body and you're not able to have children, you mentioned the blockage of tubes, but that's for women, and that's not all. So what else is there happening in the body that causes someone to fail to have a child or to conceive?
Okay. In line with STIs, they not only affect the tubes of women, they can also affect tubes of men. And someone will fail to produce enough sperm. Hence, they will fail to make someone pregnant. There are other causes of infertility, but the one that is in line with STDs, it is an effect on the fallopian tubes, which in Luganda women call it enseke. And the more episodes you have of these infections within the fallopian tubes, the higher the chances of them getting blocked, because as they heal, they form scars, and these scars will interfere with the integrity of the fallopian tube. Yet fertilization naturally takes place within the fallopian tube. Yes.
For the women that are watching us this morning, how do STDs cause, how are they related to the chronic pelvic pain, as well as ectopic pregnancies and a lot of other things that happen within the pelvic area?
These infections, if a woman acquires them, they bring about what we call inflammation. And inflammation, basically different chemicals will come up to try and fight the infection. And the effects of these chemicals, or what we call cytokines in science, will present with pain in the lower abdomen. And this is one of also the commonest reason why women come to seek gynecological related treatment. And during the workup, we perform, there are some tests we can do, and some of these tests check for the patterns of the tubes. There is one that we call HSG, hysterosalpingogram. This checks for the patterns of the tubes, and it will give us an insight on whether the tubes are open or not.
We're going to pick up our conversation from that because we're in time for a commercial break, but also to find out men are being a bit underrepresented here. So when we come back, we shall focus a little bit more on men. But if you're watching NTV Medical Matters, we are taking a commercial break. When we return, we continue our discussion on STDs and how they impact our lives. So stay with us. A very good morning and welcome back from that break. You are watching NTV Medical Matters. We are supported by Bill and Melinda Gates Foundation. I am Viola here, and in studio with me is Dr. Damalira Adrian, and he is a surgeon. He's also a gynecologist, and he's talking to us about the impact of STDs on our lives, on our bodies in the long term, but also in the short term, especially in cases where you're not able to understand that you're sick only for yourself to find out, for example, you're infertile when you try to have a child. So let's continue our discussion, and this time round also remember that we are streaming live on X as well as our website at NTV Uganda, and you can follow the conversation on several platforms as well, NTV Uganda, and be able to give in your comments. And one of the comments that I've seen actually in the break on Facebook is that it's a question about genetics. You know, are STDs genetic? Will I produce a child with STDs already? Please clear that first before we head into the conversation concerning men and their role in this.
I want to state that STDs are not genetical. However, a mother can pass it over to a child when the baby is still inside the womb or during the process of birth, and we call that congenital. So most of these, in fact, they can be passed over to the newborn, but it is not to do with the genes. It is not to do with the genes. Like HIV, hepatitis B, chlamydia, syphilis, a baby can be born with these diseases, but it does not mean that it has been passed on through genetics. Yes.
So for a mother that is expecting a child right now or are nearing their time of delivery, how best can they handle their pregnancy, or what should they look out for when that time comes in order to keep their baby safe, even if they may not know their status with STDs?
The first thing is, as soon as you realize that you are pregnant or you are planning to get pregnant, you need to go to a hospital and we do some of these screening tests. The good thing, most of these diseases we are talking about, we are able to test them. And as soon as we find you with any infection, we shall start you on treatment, and this will reduce the burden.
Are there cases you've encountered, doctor, where a couple was struggling to have children and then you discovered it was an old forgotten STD or an STD that never showed symptoms at all, but either of the two had it?
As I said, one of the commonest causes of infertility is a disease, is tubal disease, or what we call tubal factor infertility. And most of this disease is as a result of a previous STI. So if you are there and you are failing to conceive, and you visited the hospital, they told you you have a problem with your tubes, and it is likely to be the reason why you are not getting pregnant, chances are very high that you had a previous STI several years or months before.
So as a laparoscopic surgeon, what is some of the damage that you have found in your patients that they were not able to see before, but you as a surgeon have encountered and would like to tell our viewers to look out for?
Those that have accepted to go through laparoscopy. Laparoscopy, basically, I think I need to first enlighten the viewers. Laparoscopy, basically, we mean we introduce cameras in someone's stomach, which I prefer calling the abdomen, but for our viewers to quickly understand, we introduce cameras inside your tummy, and we are basically looking at how the uterus is looking like, how the tubes are looking like, how the ovaries are looking like, or any other problem that might be within your stomach or your tummy. And then those that need to be treated, we go ahead and use special instruments to correct the problem. So basically, we are correcting the problem without the normal cutting, where we put a big scar and we access what is inside you. So here we are using cameras and through small holes. So during such examinations or such procedures, many times we find fallopian tubes with fluid, what we call hydrosalpinx. It is like a cyst. The tube has fluid in it, and it is as a result of the tube being blocked and the forming fluid has no exit route, and it accumulates there. So through laparoscopy, we are able to unblock, we are able to correct the problem, and the moment that is not corrected, even if you go for IVF 50%, it might not be successful. Or if you conceive, chances are high that still the baby will come out. So having a hydrosalpinx, it is very dangerous, and we need to address it as soon as possible, even before you go for IVF.
I'll be talking about a bit about miscarriages. Beginning to think that perhaps some miscarriages we've seen could be a result of STDs, but how likely is that from your experience?
It is very possible that one of the long-term consequences of STDs or STIs is a woman losing her pregnancy, or what we want to term a miscarriage. And most of these infections can make a woman lose her pregnancy before the due date, ranging from the bacterial ones we talked about. They can excite the cervix and it opens. The syphilis, if it goes to the baby, it can excite the system, and the system tries to eliminate what is inside. The baby can die from inside. So most of these can subsequently lead to someone losing their pregnancy. So the earlier we diagnose it, the better, and we start you on treatment.
I just want to look at the positive sides of surgery. I understand surgery is never easy. I mean, you talked about creating a big scar. I haven't healed from that. But I just want to look at how surgery is positive on the other side of everything. I just want to remind our viewers that you can be able to call in and ask the doctor in real time. In case you have any question that's burning in your mind, feel free to call in and we shall receive that call and be able to have the answer from our doctor here, Dr. Adrian. But looking at surgery and its negative impacts, and the imagination I have is just gruesome in my mind. But looking at surgery, is there a positive side where, say, for example, after surgery, a couple was able to have children? Have you experienced something like that?
Okay. Surgery, yes, everyone fears surgery, including myself.
You do?
Yes, but surgery is a form of treatment. There is a problem you will have, and the only way to solve it is by surgery. If you don't do the surgery, you'll stay with the problem or you will die. So if surgery is called for, we should accept. Some of these problems we're experiencing on the tubes, many times when we correct the problem, women can conceive.
That's good news. Conceive.
As I said, if, for instance, you have a hydrosalpinx and you go for IVF. IVF, I mean, we are combining a sperm and the egg in lab, and what has formed as a baby, we introduce it in someone's uterus to carry on the pregnancy. So if you go for such a procedure and you had a hydrosalpinx, chances are high that the procedure won't be a success. So many times we advise to first go for that surgery to either take off the such tubes or to cut off the communication between the tube and the uterus to increase your chances of having a successful IVF. So depending on the problem, surgery can help a woman to get pregnant, especially if the damage is not so severe.
Would you say the same for men?
For men, if you have an STI and it ends up blocking your tubes that aid in transportation of sperm, the success rates might be very minimal. But we have other measures we can use to help you get a child.
Men and women from time to time may experience lower abdominal pain. What are some of the other diseases in the human body that may present as STIs when they're actually not?
One of the problem we are not seeing is what we call endometriosis. Endometriosis, basically, the inner cells of the uterus are seen in other areas, like the ovaries, the intestines.
So, Doctor, pause there a bit. We have phone calls coming in, and we shall be picking about 3 at a go. We capture the questions and be able to answer them all at once. So, if we have a call, we can first speak to that person before we continue. NTV Medical Matters. Your name and where you're calling from?
I'm called Winfred Auma from Namaingo district. I've just watched the show, and I would wish to request.
Let's talk about endometriosis as we wait for our first caller to come through.
Yes, endometriosis, women can experience chronic pain,
Hello?
yet it is not sexually transmitted.
Okay.
Women can have fibroids, and these can cause pelvic pain or abdominal pain or stomach pain. But all these are not as a result of sexually transmitted infections. As we said, sexually transmitted infections, the greatest percentage don't have signs and symptoms, but they come later.
Okay, so our caller is coming through. Hello there, NTV Medical Matters. Your name and where you're calling from? And your question.
Hello. Yes.
If you can hear us, please tell us your name and your question, plus where you're calling from.
Yes.
Step away from your TV set and tell us your name and your question, please. Yes, please.
Yes, I'm calling from Nambola.
Okay.
Yes, I want to my wife has not been busy. The same thing there was that.
We can't get you clearly. Could you
Yes.
please speak up? Could you please speak up?
I'm praying.
Yeah?
Yes, I got to experience something that the doctor was explaining, saying the woman sometimes can feel a pelvic pain or the abdominal pain while having sex, but there's no any production. So I wanted to ask you, is it the problem with the STD with me or with the woman, or both of us?
All right, thank you for your question. If we have another caller, what is your name and your question? That is a question about if the woman experiences pain while having sex, does it have to do with STIs? Is it a problem with him or with the woman? That's what I captured. I hope you did too. And yeah, I don't actually get it. But if you're there, what's your name and what's your question? Also, where are you calling from?
Well,
Could you please speak up?
I'm calling from
I cannot get you. Please speak up. Try to speak up and step away from your TV set. The sound is very poor. We are not able to hear from this particular caller. Hopefully you can call again, but we have one question so far. Anybody else with a question, please call in and we ask the doctor. If you can hear me, what's your name and what's your question and where are you calling from? Please, when you call in, make sure that you step away from your TV set because we are getting an echo and as you can see, your calls are not able to go through, so please make sure of that. Step away from your TV. Don't watch yourself as you call or watch yourself from a distance. Yeah, so if you can hear me, what's your question and what's your name?
Yes, hello, good morning.
Good morning. What's your question and your name?
Yeah, I'm speaking with Ewa Ibrahim from Where Assistant.
Okay.
Thank you for the program.
You're welcome.
Yeah, my question is it normal for a woman to have a pain during the menstruation period? And I have a child, but it has become a bit difficult to conceive another one. Whenever the woman conceives, experiences pain, after experiencing the pain, and gets miscarriages. So I would like the doctor to explain out for me what would be the cause about that.
All right, thank you, Ephraim, for your question. You had that. Yeah, woman conceives and experiences a lot of pain, then miscarries. And yeah, I haven't heard of that before, but it's a question for you too. Any other caller there?
Hello.
Yes, please. What's your name and what's your question? And please speak up.
I'm Enoka speaking from Kawenga.
Okay. Okay.
I also infection is every time. Again, and our boy now we are trying to create another one. It's straight, never infection. Yet we are getting treatment and nothing like came. What will be the
Okay. Yes, so our 3 questions are up, so we shall have to first answer these ones before we forget them. So if you have any other questions, please prepare them, but the doctor will first tackle these ones. And yeah, so the first question, we had a question about experiencing pain while having sex, I believe. So that was a question there. And the next one was about miscarriages. You know, she feels pain when she gets pregnant and then miscarries. And then this other, first do the first one.
The first question, they are experiencing pain while having sexual intercourse. I don't know whether it was only the woman or both of them, but having an STI or STD, both a woman and a man can end up experiencing pain during sexual intercourse. So it will be very important for the couple to visit a hospital, and we exclude STIs or even other possible causes. But one of the things we need to exclude is an STD. It is very possible. Then the next question was about
miscarriage. She experiences pain as soon as she conceives.
She's able to get pregnant, but experiences pain, and then later she loses the pregnancy. Yes, there are other causes that can lead to a miscarriage. Many times, when a miscarriage is coming, many times women will experience some pain. Now, what has caused the miscarriage, it is what we need to investigate and find out. But still, STDs, STIs will need to be excluded, but there are also other possibilities. So I would advise the couple to still visit a gynecologist for assessment, and they will be advised accordingly.
And the last one, they've visited, I believe, a gynecologist. They've got all sorts of treatment for STIs, but they are recurrent, and the woman is not able to I believe, to have a baby because of the recurring STIs. What could be the problem, or what should they do?
I think for that caller, I beg to use Luganda because he changed to Luganda. So, omukyala yenna wabanga afuna recurrent infections, obanga bamujjanjaba tawona, we need to be sure that is the partner or are the partners being treated.
The man said he's all right. He's actually fine. He's seen nothing.
As we said, obulwadde buno obwa STD oba STIs abasinga tetufuna bubonero.
Oh, yeah.
Omukyala ajja kubanga mulwadde nga nze omwami sirina kabonero. Naye tekitegeeza nti siri mulwadde. 70% oba 7 ku 10 abafuna obuwuka buno bamaliriza tebafunye bubonero, naye okukosebwa okwo ne kusigalamu mu systems damage negenda maaso. So omwami okuba nti ye talina kabonero tekimuggyako kuba nti talina buwuka obwo. So ekisookebwako omukyala wabanga ajjanjabwa naye yeetaaga obujjanjabi. Ekirala waliwo tests endala eziri advanced zetusobola okukola, naddala test gye tuyita eya culture and sensitivity. Test yeyo etuyambako okwongera okutegeera akawuka kikennyini akayinza okuba nga kaleeta ekizibu era ddagala ki ettuufu erisobola okukatta.
Hey, speaking of treatment, we are winding up because our time is up, but you will read out your contact for those who want to find you, but quickly take us through the treatment options in about 2 minutes so that they know what they're looking for.
Okay. Treatment, we should start with prevention. How do you want to prevent this? 1, please engage in sexual intercourse with use of condoms. 2, as soon as you experience any sign and symptom, go for checkup and be treated. 3, to the health workers and to the patients, always let us treat both sides. If it is the woman who has come for care, at least give them medicine to take for the partners or the husband. If it is a man who has come for treatment, endeavor to provide the treatment to his sexual contacts. Now, depending on the problem or the cause, if it is bacterial, many times we use antibiotics.
Okay.
If it is viral, many times the body tries to eliminate the virus. And when it fails, it will stay in the system and it causes long-term effects. Of course, for HIV, the drugs are there. If you have been exposed, there are drugs we can use to minimize your chances of getting the virus.
We've had those conversations here too. So because of time, I'm going to ask you to read out your contact for our audience and we shall be leaving.
My contact is 0704 5581 84 or 0786 787 111.
Okay, thank you. And so if you did not catch the contacts, you'll be able to find it on our YouTube, NTV Uganda. We usually have our episode uploaded there, so feel free to rewatch it and learn about STDs from the doctor. Thank you very much, Doctor, for your time and insightful conversation. And to you, dear viewer, thank you very much for always being a part of NTV Medical Matters, learning and staying healthy. STDs may be silent, but truly their outcomes are not going to be silent. They're going to be very loud and ruin your life, which is why you shouldn't ask the question of, do I feel okay? The question is, am I really okay? So go for the test and be able to take care of your life. I am Viola Sasser. This morning was really nice having you here. This is NTV Medical Matters, and we are supported by Bill and Melinda Gates Foundation. I wish you a lovely festive season and New Year.